So this is now DT4, so it's kind of going slightly back in the pecking order. It's relatively short. It's literally just 2 pictures of the casualty assessment form, which some of you might already have seen, to be honest. But we're just going to go over that, how you would use it in a situation, and the little fine details of that. So this is the front of the casualty incident procedure form. It has all your useful information. I'm just going to get a laser pointer up so I can point. So let's go top down. This form is in basically all of our folders when we take those with us to Stony Cove and that sort of thing. Sometimes we have slightly adapted versions, but they're all pretty much exactly the same. In very kind of Hitchhiker's Guide to the Galaxy thing at the top, don't panic statements, take control, assess the situation, delegate action, contact emergency services. This is going to be kind of an introduction to instant scene management, which we will do in a practical session at some point. Obviously, we're not sure when exactly because we need a physical room to do that. But consider this an introduction. So these are the steps you typically take in that situation. As we all know, what's the first step in our casualty kind of reaction procedures? Any suggestions?
It's not this Dr. ABC malarkey, is it?
It is. It is.
Oh, well,
so,
then.
Correct, Amundo. So we make sure there's no danger to ourselves. Although, let's assume here that we've had a situation where a diver has surfaced unconscious and their buddy has towed them to the side in Stony Cove. And let's pretend that the Stony Cove rescue team are on a lunch break or something, and it's up to us. So we've cleared them from that danger because we've got them out of the water. What's the next step once we've got that casualty out of the water?
Response.
So we've checked our Dr. ABC and they're unconscious, they're not responding. What do we do now? What's the most important thing?
CPR.
CPR. What do we do before that? What do we do immediately if we know there's a problem?
I'll get help.
There we go. Get help.
Get help.
Get help. Emergency services for the United Kingdom. Okay. It's got the contact details of every single emergency service you could think of, both at sea and on land. Our version is slightly modified for this because we include the phone numbers for the local RNLI station as well. But the general gist of this is for Coast Guard, VHF radio channel 16 is the one you always want to call on if there's a major issue. Mayday call and PAM-PAM calls. Have we covered this yet? I don't think we have. Mayday and PAM-PAM. No, we haven't. So we'll come back to those. We're doing it slightly out of order just because we don't have any physical rooms, but we'll come back to those. You've got the contact numbers for your decompression illness, the British Hyperbaric Association and the Royal Navy Divers Helplines. They are there. They are open 24 hours a day, 7 days a week, 365 days a year. These guys do not sleep. They do not have a day off. They are literally always there. So if you ever have any kind of worries about decompression illness, any questions, obviously in an emergency sense, call this number and they will help you. They will tell you what to do. In terms of near drowning, so if someone's kind of almost drowned in the water, they've inhaled a bit of water, they're still conscious, they're responsive, but they've got out of the water, they're telling you you're fine. Are we just going to go home and call it a day? Or are we going to do something about that?
No, you have to take it as seriously because they can suffer from secondary drowning then.
Absolutely. Secondary drowning is a major concern with near drowning. So we'd call the ambulance, 999. Yep. And then with a lost diver, I can't really hide this, which is really annoying, but who do we call? The Coast Guard or the police? Okay. So lost diver, you call the police, 999. Not the RNLI or anything like that. Okay, so that's the contact details. Just looping back to this Mayday PAM-PAM thing again. We'll cover this in a bit more detail once we do the practical session. But if you have life in immediate danger, so if you have someone unconscious, someone with the bends, someone who's had their leg chopped off by a boat prop, anything like that, Mayday is what you call on channel 16 on the radio. Okay. Most modern radios have the a big red button for distress, and if you press that, it'll automatically send a mayday call out to every single boat in the vicinity alongside the Coast Guard and the RNLI, and it will transmit your GPS location as well, and it will come up on everyone's map as well. So modern situations, it's normally just a press of the button, but historically you've had to call mayday, mayday, mayday on channel 16 on the radio. If you have decompression illness that doesn't have major symptoms at that point, pan, although in all honesty, if I had someone who actually does have decompression illness, I'd be calling mayday because that could kill them. Pan is kind of, it's not a life-threatening emergency. So this will raise some help, but it isn't kind of end of the world emergency sort of thing. Again, we'll cover that in a bit more detail once we do the practical session. So moving on, decompression illness, it just gives you some hints and tips on what to do for decompression illness, although all of you should really know this by now because you've done sports diver and similar courses. For basic life support, does this ring a bell for everyone? Hands up for ringing a bell. Yeah, most people. Okie dokie. So obviously check the safety. Are they responsive? What's our acronym for responsive?
AVPU.
AVPU. Absolutely. And what does that stand for?
Alert, voice, pain, and responsive.
Correct, Amundo. So
Unresponsive.
AVPU. Yeah. If they're unresponsive, get help or call the emergency services. Open the airway. Are they breathing normally? Main word there. Are they breathing normally? Send for or go for an AED. What does AED stand for?
Automatic external defibrillator.
Yep. Also calling emergency services there. And then we do our basic life support cycle of 30 chest compressions and then 2 rescue breaths. Okay. If we have an AED, use it immediately. We should be happy with that. Should be a bit of a recap. So now let's get on to the bit where you actually have to do something. So this part of the report you will fill in as a dive manager. You could delegate this to someone if you feel like you need to be on top of something else. So maybe you're not filling it in, but it's good being familiar with this sort of thing. So it's relatively self-explanatory. This is just getting the details of the dive that they've just done. So casualty name, was their ascent normal? Yes or no? Was it rapid? Yes or no? Any missed stops? So what does that refer to? Missed stops?
Deco or safety stops.
Deco stops is what I'd put for that. Safety stops are non-mandatory, so I wouldn't include those in the minutes. But decompression stops are mandatory, so we'd include the number of minutes of decompression that they'd missed. We'd find that out through either asking their buddy or looking at their dive computer. Or, as a dive manager, you should have everyone's dive plan as well. So, little note here, use separate sheet for buddy. Obviously, you want to keep the two details separate. And then we want to give details on all the different variables in their dive. Some of this you'll just put NA. So if they're doing no decompression diving, all these stop boxes are just going to be NA. But your depth, dive time, surface interval, all that sort of stuff, you want to put in those boxes. Any previous dives that they've done as well, put the details in here because that may inform decompression illness requirements or anything like that. But that's all relatively self-explanatory. Are you happy with all of that? Everyone hands up if you're happy with that or anything you want me to explain. Everyone hands up. Cool. So we'll flip over to the other side. So this is a little bit more detail on here. So this is a casualty assessment form. Normally this goes hand in hand with the incident procedure form. And it's very similar, but basically we're monitoring the casualty. So we have a date, casualty name, age, basic details. Onset of symptoms, time and description of those symptoms. Okay. So for decompression illness, what sort of symptoms could we have? Shout out. Image trying to escape the question. Itching from Kev. Yeah. What would that maybe point me to in terms of physical symptom?
redness of the skin.
Redness,
Rashes.
rash.
Like a
that
rash.
sort of thing. Yeah. Anything else?
That was the one with like they say that there's nothing wrong with them. They keep saying they're fine.
Denial.
That's the one.
Yep. It's always a good one. What other symptoms of decompression illness can we get? Literally anything. Come on.
Joint pains?
Say again.
Joint pains or like numbness?
Pains in the joints. Yeah, absolutely. That's a good one. Why do we have pains in the joints in particular?
Bubbles form in the joints.
Bubbles can get caught in the joints, form in the joints. Typically, the tissue in the joints is a type of tissue that releases nitrogen more quickly, fast tissue. So yeah, absolutely. Joint pains is a good one. Anything else?
You get like a crackling voice.
Crackling voice. So we get a pulmonary edema. So that's when the bubbles form underneath our skin and around your kind of collarbone area. If you press the skin there, you'll get something that sounds like bubble wrap popping. Also, your bubbles can distort your voice box. So if they're pressing on the voice box, they can change your voice. So yeah, if you get a voice change, that could indicate you have some kind of edema. Anything else?
Disorientation.
Disorientation, confusion. The main one that you've missed so far. There's
Unconscious.
Unconscious. Yeah, unconsciousness. That's a couple of symptoms. There's a big list of them. I'm sure you guys know them, but for the sake of time, we'll carry on. So you put those sort of symptoms in this box just as a quick assessment. The main thing you want to do is record the time. So at the very top, this row, it says time, record observations every 15 minutes and when the casualty conditions change. So each column is dedicated to that time slot. So if I've recorded it at 1 o'clock, I'll do another one at 1:15, 1:30, 1:45, 2 o'clock, and so on. And each column is dedicated to that time slot. We then have our basic life support analysis here. So what kind of response did we get for AVPU? And just put the letter there. Details of BLS that we've conducted already. So what times we started, any times we had to stop for whatever reason, if the AED was doing its thing or if someone got tired or something, they had to go and do something else. So details of that. And then any sort of use of an AED as well. Note any shocks given, ideally what time they were given as well would be quite useful. So once we've done that, then we're going to go into the kind of monitoring phase. So do they know orientation? So do they know what day it is? Do they know where they are? Do they know who they are and who you are? That's normally a good indication of any sort of head trauma. Decompression illness can be head trauma as well. It's not necessarily just a smack in the head. Do they have any sort of personality changes? Tick or cross. Any chest pains, respiratory rate changes. So record their respiratory rate and see if the number changes over that time. Any pulse changes. Obviously, this is a tricky one to measure. Typically, we don't teach to measure pulse for a couple of different reasons. Cold divers tend to have a very weak pulse, get restricted blood flow from the wrist seals of dry suits and so on. So that's slightly more temperamental, that row. Any sort of vision disturbances, so tunnel vision, blurred vision, double vision, spots in their vision, anything like that, that typically indicates some kind of trauma to either the vision section of the brain or to the optical nerves or the eyes. That can be from decompression illness. Any sort of head or neck injuries, so tingling or numbness, any sort of facial weakness on either side, that could indicate strokes. Upper limb tingling, numbness, and it's basically the same thing, body part numbness and tingling and any weakness. And then eye-hand coordination. So how could we test for eye-hand coordination? Any ideas?
Can you do like the rubbing your belly and patting your head thing? Can you ask them to do that?
Yeah, potentially. That's kind of hand coordination, isn't it? Another good one is get them to stretch their arm out in front of their face, get them to close their eyes and then touch their nose. And if they have any sort of trauma, they'll miss their nose and poke themselves in the eye or something. Another good one is putting your finger in front of their face, getting them to follow the finger, make sure that they follow it smoothly with their eyes. It's not kind of jerking across, and also get them to touch your finger. Sometimes they'll miss the finger and that'll indicate that there's a problem there. So just see if you can measure that. We also want to have a look at what sort of oxygen therapy we've given them. So percentage of O2 that we've given them, time started and stopped, all that sort of stuff. And then fluids administered. This is really important, the fluid administered part. Why is this important? Let's say we have someone who's cut their leg really badly, like we have an arterial bleed on a leg. Why is it important that we need to know when they were administered any fluids?
In case they want to do surgery?
Absolutely. So surgery, those who have had it, obviously you can't drink or eat anything for a certain amount of time before. So if we're administering them fluids on the boat because they say they're thirsty or anything like that, and then they need to go into surgery, potentially they'll have to wait before they go into surgery. Otherwise, they might risk regurgitating the fluids and drowning on them. So you should know from your sports diver training that any sort of injury that would potentially require surgery, you shouldn't be giving fluids. Can we give people fluids for decompression illness? Anyone? Is that no one knows? Hands up if you don't know whether you can give someone fluid for decompression illness. So everyone knows, just no one wants to talk to me. Okay. So you can give fluids for decompression illness. Okay. Just water, ideally, not coffee. Why do we not want to give people caffeine when they have decompression illness? What does caffeine do to our blood vessels?
We'll hide the symptoms on it.
It can hide the symptoms. It can make them worse as well because caffeine dilates the vessels, and so that increases the blood flow and potentially increases the flow of bubbles around the body towards the brain. So we don't give caffeine to people with decompression illness, but we can give water because there's no surgery we can do to repair decompression illness. So there's no worry about them going into surgery. But yeah, that's pretty much it. And then some contact details at the bottom of the slide as well, just to go over. But that is the casualty assessment form and the incident procedure form as well. Any questions about any of that at all? Once again, stunned silence, which is always nice. In that case, that's everything I wanted to get done tonight. So we're finishing quite a lot earlier than we normally would. I still plan on having training next week.